everyone, and welcome to Our Ventura TV. I'm Sandra Siepak. On today's show, we're welcoming members from the Alzheimer's Association here in Ventura County. We have Donna Beal. She is the Vice President of Programs and Advocacy for the Alzheimer's Association, and also Amy Marshall. She is a VP of Development and Communications. Thank you so much
Thanks
for joining us
having
on
us
the program today. Alzheimer's is a really important subject, so we want to cover as much as we can about it today. We'll start with you, Donna. I'd like to kind of give a little bit of information about Alzheimer's Association and what you do for folks here in Ventura County.
Absolutely. So the Alzheimer's Association in Ventura County, we have an office on Main Street. It's 2580 East Main Street,
Okay.
Which is easy for, I think, families to get to. It's fairly close to Community Memorial Hospital. And within the organization, which of course we are one of 80 chapters in the nation, and irregardless of where somebody goes with those chapters, they're going to get the same services.
Okay.
So we have 5 core services. We like to keep things simple at the Alzheimer's Association, 5 core services. So one of them is information and referral. So if somebody comes to us and says, you know, mom's just been diagnosed and we need to get our legal affairs in order, we can give them a list of elder law attorneys. That's just an example. Another service we offer is support groups. For the county, we have 21 support groups that are offered. Some of them are offered twice a month. So during the month, 36 support groups all total will be happening. So plenty for folks to be able to get to in the county. We also offer education for family caregivers that goes basically the entire gamut from diagnosis all the way through end of life. And those classes are offered on a monthly basis at a regular time within partner settings at community-based organizations so that families can get to them. They're free for them to attend, for them to be able to learn more about the disease, its progression, caregiving, how to handle it, all of those types of things. We also offer what's called a care consultation, which some folks have a hard time understanding. Think of it as your emergency room visit, in that you're in a little bit of crisis in caregiving and you're not sure what to do, where to go next. You can come in and meet with one of our staff. We can help you filter through that and figure out, okay, all of this that you're worried about right now, let's place that over here. This is what you've got to deal with right now. Right? So we can help filter through that. Then the last service we have is our safety services. A lot of folks with dementia, they'll wander, right? Or you need to safety-proof the home. And families struggle with how do we deal with this? What's causing it, and how do we deal with the issues related to that? So we can talk them through those types of things as well.
Which is all extremely important, especially when you get that first diagnosis. A family gets it, and it is a family because even though one person in the family may have it, it affects everybody. This is something that everybody's got to work toward one goal, and that is to take care of this person that has been diagnosed. So it's good to know that these services are available for everybody, not just the patient. Which makes a big difference. So those types of services really can focus on this person getting what they need to have an extended life that's going to be helpful and living well.
And I think the critical thing to understand is, one, every year the association does something called Facts and Figures. It comes out in March. It's a great tool for families to get connected to understand, you know, this pathway in front of them. But also within that, it also helps us and our community partners understand, I don't know where they come with the 0.5, but it takes 2.5 people to help care for someone who has dementia, and the primarily the source of care for folks who have dementia is the family unit. So you're absolutely right in saying that when somebody has this diagnosis, whatever disease is causing the dementia, it's not just the person, it's also the entire family unit that is helping to provide the care for the person who has dementia. What we also know, and this is the critical part, most of our work is with the caregiver, largely because the more educated the caregiver is, it's going to affect the end-of-life care for the person with dementia and the primary care, but it also affects health outcomes for the caregiver. You know, a lot of caregivers, the spousal caregiver, for example, is more likely to pass away than their loved one who has dementia first because of the stress of caregiving. So if we can help alleviate some of that stress with support groups, with education, with the other services that we offer, it helps their health outcomes in the end.
When someone comes to you, comes to your office for the first time and says, let's say an example, my husband has been diagnosed with Alzheimer's. I don't know where to turn. Do you explain a little bit more about the progression of the disease? Do you explain what you can be doing for that person at that moment, or are they then given resources to follow?
So I think what's really critical to understand is a lot of folks use the word dementia and Alzheimer's almost interchangeably.
Yes.
And so let's take a moment there.
Okay.
One, dementia is an umbrella term that we use to define that something in your brain isn't working right. There's signs and symptoms that something isn't working right. But here's the thing that is the most complicated for folks to understand. It's actually not the disease. What's happening is there's a disease in your brain that's causing the dementia symptoms.
I see.
Alzheimer's is the most common disease that causes those symptoms.
Oh, okay.
But there's 57 diseases that actually cause dementia symptoms. Vascular dementia is another one, Lewy bodies dementia, frontotemporal dementia. That's just 4.
Right.
Those are the ones that tend to happen. So what often happens is the family comes in and says, you know, my husband's just been diagnosed with dementia.
Okay.
One of the first questions we ask is, did the physician tell you what disease is causing the dementia?
Okay.
Because that helps us figure out how to help you help your husband.
Right.
Right? And then you don't know where to start. Well, let's figure out what you need to know about the disease and caregiving strategies based on what we know about the disease causing the dementia. If it's Alzheimer's, short-term memory is an issue oftentimes. If it's vascular dementia, though, the disease doesn't necessarily affect short-term memory or even memory in general. It affects where the stroke affected the brain. I had an aunt who had vascular dementia. For her, it was her language.
So it can affect different parts.
Yeah.
Not always for everybody it's the same. So
Correct.
that makes a big difference. Now, Amy, being in charge of communications, I would imagine you do a lot of speaking and getting out there to groups. How does that make a difference for so many people?
Well, I think one of the wonderful things about our organization is that we are under a national umbrella.
Right.
So we have so many resources available to us that we would not if we were just local.
Sure.
So we are everywhere that we can possibly be. So we use traditional media, we use social media. We have a very active website that is supported by our national organization. The materials that are available to us for distribution are pretty incredible. And we have 5 offices, and we have employees in all of those offices who have the ability to go to the community, to go to Rotary and make a presentation and educate the community.
That's very important. And research is a big focus of Alzheimer's. Research today is right on that button of hoping to find a cure and hoping to help many of these people who are afflicted with it. So are there some new breakthroughs that we may not be aware of?
That not everybody is aware of, right? Well, so I think what's important about the research that we're doing is the Alzheimer's Association a few years ago, in 2010, really pushed the federal government into passing the National Alzheimer's Project Act, or we call it NAPA, right? Okay. Everybody likes acronyms. And within that, what we said, instead of Congress saying, here's how much we're going to give you to find a cure, right? We flipped that and said, how about we ask the scientists who know this issue how much they need to find a cure, and let's work toward getting there, right? 9 years ago, there was about $400 million going toward research. Now, 9 years later, it's $2.3 billion going toward research to help us get to ultimately what we want, which is kind of to work Amy and myself out of a job and find a cure, right?
I'd be happy to be out of a job someday.
I would be happy
for that, yeah.
Exactly. And so because of that, the Alzheimer's Association on a global scale, not just in the United States, but on a global scale, is looked at as a convener and a catalyst for the research that's happening. And so within that research, we have 4 buckets, if you will. One is discovery science. This is where we're looking at cutting edge research on molecular biology. The next one is really around early detection, and that's a critical piece because we need to get the right people into the right studies so that we can test whether or not the treatments that are being tested are right. Okay? Then you're looking at treatments, okay? And then the last one, of course, that we're looking at is prevention. So if you look at one of the big things right now, that cutting edge stuff right now, the Alzheimer's Association put $38 million of its money toward the US Pointer study. The Pointer study is a replication of something that happened in Finland called the Finger study. And within the Pointer study, what they're looking at is lifestyle interventions so that we can now say, if you do this, you could prevent the disease. We can't say that right now. So the study is looking at that. We put $38 million. The National Institutes of Health put some money into it as well. That's one cutting edge piece.
And that is making a breakthrough. That
It
gives you
is.
a better idea of where the Alzheimer's, is starting
Right.
in the event of somebody's life.
Right.
So that makes, all the
Right.
difference. I know one thing that we find to be very, very important is, of course, funding. So we need to know where the funds are coming from, especially locally, if you
Absolutely.
can just elaborate on that a little bit, of where the funding locally comes from.
Yeah, one of the things I love about my job, because I love that I get to raise money to help
Yes.
fight this disease. That's really an honor for me.
Sure.
But one of the things our organization gets right is that we raise money from large donors who make major gifts to our organizations.
Okay.
But then our biggest fundraiser are our walks to end Alzheimer's. And
Okay.
we do 5 of them. There's one in Oxnard and Westlake. Those are the 2 Ventura ones. But
Okay.
there's also one in Santa Barbara, Santa Maria, and San Luis Obispo. And through that vehicle, we get people who walk and raise money from their family and friends. So there's an opportunity to support us at every level.
Right,
no
and
matter-
everybody can get involved.
Absolutely.
Yeah, you can get everybody
And you
involved.
can find more information about that at our website, which is
Okay.
www.alz.org.
Wonderful. That's very important. What's the biggest need for your organization locally right now? Volunteers? Is
Yeah.
it more contributions? What would you say would be the biggest factor that you're looking at?
I know the biggest factor I struggle with is I need to replicate my staff. There's we need the volunteers in the office who can help us get the word out in
Right.
the community about the services that are available.
Okay.
But I also think we need volunteers who are willing to help out with the events that we do and really be the boots on the ground to help us get these kinds of things done. Volunteers, volunteers, volunteers.
Well, and for our organization, volunteers are important at every level. Again, we need people in the office who can stuff envelopes,
Sure.
but we also need good volunteer leadership. So if people are interested in getting involved and they really want to dig in their heels and make a difference, we've got lots of great leadership roles with our walks, with everything that they can participate in.
Right. Now, you mentioned you have an office here on Main
Yes.
Street in Ventura.
Yes.
Do you have a large staff here, or do you rely on a lot of volunteers at that particular office?
We do rely on a lot of volunteers at that office. This
Okay.
organization is really a grassroots organization.
Okay.
It was started in the 80s, very grassroots, and it's still very much, we stay true to that. The reality is we're not going to be able to reach everyone that has this disease with the staffing, even if we were a large-scale hospital type setting.
Sure.
So we need to be able to reach those folks who, for whatever reason, don't come through our doors. We do that through our website. We do that through partnerships with, say, for example, 3 of the audiences that we really want to be able to connect with are the Hispanic Latino, who have a 1.5 time more likely of developing the disease than Caucasians.
Okay.
African American, it's 2 times more likely than Caucasian. And then the LGBTQIA community, who are adversely affected in utilizing the healthcare system. Those are audiences we really need to reach,
Right.
and we want to work within those communities. And so we need the volunteers from those communities to help us do the outreach there. Or as my promotora friends would say, in reach, because they are part of that community.
Absolutely, that does make a difference. So let's get the website one more time from you,
One more
Amy.
time, www.alz.org.
Okay.
And you can find everything there. If you are a corporation that would like to sponsor a walk, you'll find our levels of support, which range widely there. So it's a great tool.
Yeah, and the walks are really beneficial for everybody to get involved in. There's great money that can be raised for making Alzheimer's go away. We don't want to see it anymore.
That's
so
right.
hopefully this will help in that direction.
Hopefully we'll be out of work the next time you see us.
Absolutely. Well, thank you both, Amy Marshall, for being with us today, and also Donna Beal from Alzheimer's Association here in Ventura County. Great work you're doing. We want you to keep it up. I wish you all the best with it.
Thank you.
Thank you
very
so much.
Thank you.
And thank all of you for joining us today on Our Ventura TV. I'm Sandra Siepak. I look forward to seeing you next time. Bye, everyone.